last report, I saw Joshua Swift here. We have Lovette Miller actually talked a little bit about our infant mortality, child and fatality report.
Can you help me? Oh, I see it now. There. And if you need me to stay later and need an invocation at the 2 o'clock, or I'm here.
You're available? Thank you.
Okay. No, all right. I think now it's good afternoon, commissioners, not good morning, commissioners.
Yeah,
I will be, what is the time frame? I want to trust the time.
10 minutes.
10 minutes, 10?
I was going to say 15 max, but
Okay, I will try to speed up my speech. Yes, commissioners, so I have two things to report to you. The first part, and you have your sheets, I would just please disregard, we've made corrections to those sheets. We'll send those to you afterwards. So please, I assume you have the screens in front of you. So I would ask you to pay attention to those screens because that is what's been updated. So we're looking at two things. We have an infant mortality report where we're looking at Forsyth County, Durham, Guilford, Mecklenburg, and Wake counties, and then the state rate. And then the second piece is the annual child fatality prevention team report that comes to the commissioners. Usually comes in the spring. Obviously, y'all were pretty busy in the spring with budgets, and so that got delayed, and so we're doing that as well. So I'm trying to knock out two of those. So the first part is infant data. We're looking at premature births, low birth weight, infant mortality. And the reason we're looking at premature births and low birth weight those are the two things that most influence infant mortality. Then we're going to look at talk about our Infant Mortality Reduction Coalition and a safe sleep advertisement outreach that we did in those results. So I'll just move first, and I'm not going to read all of this, but you can see that in Forsyth County from 2019 to 2023, you can look at our numbers for the percentage of babies who were born prematurely. That's before 37 weeks of gestation. Normal gestation period is 40 weeks, 9 months. And you can see that overall we are trending down but still 1 in 9 babies in Forsyth County, or 10.9%, are born prematurely. And you can see we're right at the state rate of 10.8%. So, and I'll move to this next chart, which really just shows it in a different way with bars. And you can see over time from 2019 to 2023 that we're trending down. You can see where the state has stayed flat. Other counties that are our peers have some have trended down, like Mecklenburg. Wake is trending up a little bit. And you can see where Durham and Guilford have changed throughout the years. The next slide, you can see, is the percentage of babies who were born with a low birth weight. So that's less than 5.5 pounds. So you can, that's a very small child. You can see that in Forsyth County, our numbers are trending down over time from 10.6 in 2019 to 9.9% of births that are low birth weight. And you can see the state average has stayed pretty much the same. So we're slightly above the state average of 9.4% of low birth weight. And then this next slide is just another way to represent this, showing it a bar graph broken out by each county. And you can see our numbers stayed stable, but we did see a decrease in 2023. And you can see us compared to other counties. Okay, this next slide is, this is I would say if all slides are important, but this is the most important one. This is showing our infant mortality rate per 1,000 live births. So you have 1,000 live births. This is how many children that are born out of those live births that die before they're 1 year of age. You can see across all the counties, and you can see that our overall rate is 6.8 compared to the state 6.9. And so you can see that. But the important detail with this, that when you look deeper, is a disparity of 2.94, meaning the infant mortality rate for non-Hispanic Black infants is 14.1, per 1,000 live births versus 4.8 for white. So it's 2.94 times more likely the death rate per 1,000 live births for black non-Hispanic children versus white children. So when you blend those two numbers together, you look at, you have the numbers, you can see overall 6.8, but we've seen this, the disparity, when you look across the state. In North Carolina, that rate, where ours is 2.94, the state rate is 2.74. And when you look further back at low birth weight and preterm births, you see that same disparity where 2.5 to 3 times more likely for non-Hispanic black children to be born prematurely or low birth weight compared to white babies.
Before you go on, so the numbers on the screen are different from the numbers in the handout?
Yes.
The numbers on the screen are correct?
Yes, sir.
Yeah, it looks like Durham and Forsyth are reversed.
Yeah, we caught that. And you've looked at it 10 or 15 times, and we caught it this. So apologies for that. And please, like I said, I'll go make the copies. I'll bring them back here at 2. Give the invocation, and then I'll have it for you. But yeah, we'll get you the new copies. So next is the same how we've done. We've showed the lines, we showed the numbers, and here's just we'll look at it in a bar graph. You can see from 2019 to 2023 how we had fluctuations. 2020, 2021, where the rate went down. I think maybe the pandemic could have affected that, less births, and things like that. So next, I just want to highlight one within the Department of Public Health, what we're doing in regards, that's focused on infants. You can see these programs. We have our care management programs for at-risk children, for high-risk pregnancies. We have our nurse family partnership. They just had graduation yesterday. We have Healthy Beginnings, which focuses, with kids for 2 years on breastfeeding and postpartum depression. You've seen us come here with our Improving Community Outcomes for Maternal Child Health. That's the ICO for MCH. That's that grant that we got through the state that's working with Guilford and Forsyth County, working together. About our WIC, Women, Infants, and Children, where we're doing nutrition vouchers and education. And our Forsyth Mamas, which is a group that has just started in the last few years. We're focusing on mothers with lived experience so they can tell their stories to help other soon-to-be mothers. So, I would say, overall, the big thing is, the Department of Public Health, we're trying to lead this fight. And we are working with our hospitals, our healthcare providers, grassroots organizations, community partners, and leaders to have a county-wide response. And it's uniting those partners, saving lives, and again, building hope. And I would like you to see, some of you that came to the walk earlier this week, and I appreciate those that did. And I just appreciate the commissioner's support for this infant mortality. But, we have Forsyth County, within the health department, we lead this infant mortality reduction coalition. And it's no accident that in this visual, health department and the 2 hospitals are in the center. And I think that's how it should be. And we have, focusing on, all of these organizations in some way, and some are in different ways, are focused on moms and babies. And making sure, trying to reduce that gap. Yes, we want the overall infant mortality rate to keep going down, but we want that disparity to close.
Well, I think that's, by the way, I think that's a real credit. That's the kind of trend that we want to see. If all the other demographics that we compare ourselves to, just all of them, and you see what the state's doing and what other places that are far more wealthy than we are in different things in terms of overall poverty, I think you can't show causal relationships directly with these programs, but I suspect, obviously, in the combination, they seem to be making a difference, and that's a lot of hard work on a lot of folks, and clearly some other organizations. So I want to say thank you for all that.
Yeah, well, thank you, Chairman. And again, it's not just the health department and the hospitals; it's all those partners. It's the whole community. It's the faith community. It's not other nonprofits. I mean, we all want to make our community healthier. where children can grow up and have an equal opportunity to grow up and be healthy, tax-paying citizens and just contribute to the community.
So Joshua, before you move forward, I'm concerned about the 2.9 in this disparity, right? But I'm hopeful because there was an organization that I believe, and see, this is why being here and knowing the organizations that come through, I think that we miss them through the community grant funding opportunities. Forsyth Mamas, didn't they come before us to ask for funding?
I don't, so that is the group that we organize.
Oh,
So I
you
don't-
organize.
Yeah, it's
Okay.
organized through the health department.
Some organization that was doing this type of work too could probably assist in these disparity numbers, right? So maybe I just need to do more research around that. So I heard the Forsyth Mamas and I was like, wait a minute, I've heard that before.
I think Boston Thurman has a group that's been doing some infant mortality work, and I believe they are funded by KBR.
Okay. All right. Well, fair enough.
And both
Thank you.
Atrium and Novant have some similar activities where they're focused in, I think one works with, is connected to the Boston Thurman KB Reynolds and working with mothers to tell their stories and, make things
Was
better.
Boston Thurman a part of this focus partnership group?
Yeah, Boston Thurman is part of,
They
they
are.
have representation.
Okay, fair enough. And Forsyth Mamas, just for the record, is ours.
Yeah.
Okay,
yeah.
thank you.
This next slide, this shows, the number of infants who died in 2023. Again, it shows our infant mortality rate compared to the state. We're slightly below. But again, that really shows that number, like you said, Ms. McDaniel, that 2.94, the ratio of African-American babies who die disproportionately compared to other babies. Again, this was not on your slides. It went out. Ed McNeil and I were working on this last night at 8:30 to get the numbers just right, and appreciate him. So we received $6,000 from the state. When I first started here 7 years ago, how much money do we get for child fatality? We don't get a dime because previous, I guess, persons in my spot didn't want the money from the state. And I said, hey, we want the money. So we got $6,000 from the state, and we partnered with the communications department, and we did a 5-week media campaign looking at Facebook, TikTok, YouTube, Snapchat, all those, and focused on women 18 to 45 years of age, childbearing age in Forsyth County zip codes with a heavy concentration in 27101, 27105, and 27107. We got 800,000 impressions during that time. And an impression, Commissioner Wilson and I were talking about the Winston-Salem Journal. He's got the paper copy. Well, I look at the digital copy. And if I look on the digital copy and I see 2 ads for the fair, that's 2 impressions. So just imagine, you're digitally on your phone or a device, your iPad, and you see those ads. Every time you see that ad, even if that's an impression. So 800,000 impressions. The goal was to reach as many women as possible of childbearing age, and we had 65,000 times the video was seen in its entirety. That's a 15-second video, and I talked with our communications director, and he said that was well within the industry standard of people that saw it and saw the whole thing. And again, it's the premise was the ABCs of safe sleep, make sure the baby's alone, on their back, and in the crib. So, we're really, to me, for $6,000 to get that much penetration in the community, we were really, I thought that was good. Okay. So, if it's okay, I can move on. Any questions about the infant mortality numbers?
I just think we need to continue to emphasize the prenatal care aspect, try to maximize that in the community, especially with regard to the disproportion that exists. If these pregnant mothers, are getting regular care, they can identify underlying disease processes, diabetes. If they're overweight, 30 pounds gained during the pregnancy, they can get them with a dietitian. They can do things that reduce the prospect for loss of a child that may be born who won't make it during the first year. And at the Insight program that I went to a couple of weeks ago, they're working right now on a 28-bed maternity housing, I think, for pregnant mothers who are impaired, and that kind of program can save a lot of lives.
Yes, sir. Yeah, that is correct. That is correct. Yeah, prenatal care is vitally important. And it's, someone asked me a few years ago, what can we do to help? And it's really like if you could go back in time to help moms way before their health, way before they become moms, become pregnant, that health very much impacts their health, whether it's high blood pressure, diabetes, weight status, nutrition status, stress, all those things affect them and then their baby. So next, and we'll move into the Child Fatality Prevention Team report. So, and you've seen this before, so I will just highlight it real quick. So we review the Child Fatality Prevention Team. We review all the child deaths in Forsyth County. This is required by state law. We conduct our rhythm is we have a subcommittee, and on that subcommittee, you have a pediatrician from Avant, a pediatrician from Atrium, a representative officer from Kernersville PD and Winston-Salem PD, as well as the Sheriff's Office, Public Health, and DSS. That subcommittee meets 4 times a year. We review all of those deaths, and then we decide which deaths need to go to the full team. The full team includes all the members of the subcommittee, plus our medical examiner, district court judge, the DA office, Insight, juvenile court, guardian ad litem, Daymark, the school system, behavioral health, partners, and there's also a representative of a parent who's lost a child. And you all, name those members. They go through your process to be appointed to that. The other thing is to go in to the full review, or the focus is, you can see, is a systems issues, and looking at, agencies or regulations, maybe if there was something that failed the child, or some slip through the cracks, making recommendations to address those systems issues and developing action plans. And we are one of 30 counties that have subcommittees just due to the number of child deaths that we have. So you can see following conditions that go to our reasons for going to the full team: lack of communication between agencies, rules that not adequately protect the child, abuse or neglect, mental health issues or developmental disabilities, or presence of alcohol, tobacco, or illegal drug use during pregnancy. So this is our numbers for 2023. So yes, we're in 2025. But for these are the deaths. We're always a little over a year behind. So the 2024 case reviews, which were 2023 child deaths. So in 2024, we had 59 child death cases from the 2023 calendar year. 30 of those 59 cases were infants. And then you can see the summary of the 59 cases. You can see what they were from extreme immaturity, prematurity, congenital abnormalities, illness, homicide, unsafe sleep, or co-sleeping, which that was what our media campaign was focused on, accidents, and suicide. So 23 or 39% of the 59 deaths met one of the criteria and went to the full team review. So subcommittee did all, and then we took 23 to the full team.
Joshua, was anyone from the legal community on that review board?
Which on the full team?
Yes.
Now we had, I'll go over the list of members again. So on that committee, we have medical community, we have officers from Kernersville and Winston-Salem PD, we have someone from the DA's office, and we have, actually it's Judge Kazakis, the judge.
But no attorneys or paralegals?
No. Well, I think, from the DA's office is, Kia? I can't remember her last name.
Travis.
Travis, yes,
Okay.
Travis.
All right, thank you.
So now if, moving in, looking at the number of deaths over time, over 5 years that we've reviewed, you can see the total number of deaths per year. It's, from 53, 42 up into the 60s and now 59. And then you can see each type. Again, we look at all child deaths. Just some things that I note when I'm looking at this. You can see illnesses went up from 4 and 5 to now in the teens. Extreme immaturity went down. Unsafe sleep has trended is starting to go down from 2021, 7, then 6, then 3. So those are just a few of the things I would note there. Next, I would look, this is just another look at the trend, and this is a better way or a different way to show you how many are received and how many go to full team. And you can see, there's a pretty extensive subcommittee. When we look at these, we really look hard to see if there's anything that really it needs to go to the whole full team. And the last two slides are really just showing you a summary of the full team review. You can see the accidents is broken down by, and I would just say, and I know and this is wrapping up, those are some of the toughest meetings to facilitate, just, to go through it. But, we in depth, in details about, these deaths. You can see 1 drowning, 4 motor vehicle accidents, the other transportation accident, fire, ingestion of a foreign substance, 2 suicides, and then you can see the last slide is 3 unsafe sleep, which has been of these. What we're seeing is making sure we have better partnerships and just keep strengthening that partnership. The saddest thing is to see where for so long we've pushed to make sure the child has that crib and has what they need. The tools, parents have the tools they need, but sometimes those tools aren't used correctly. Either it's our and sometimes nature is your child's crying, you want to soothe them, and you're tired as a parent, and or child is in the crib, but they should be alone in that crib. They shouldn't have lots of other stuff in there, blankets and toys and all those things that they could get entangled. So that's that one systems issue that we see that we can try to focus on. These other issues, it's hard, with the car accidents and the drowning, those are some of the toughest ones because we can't, with the whole team and Ms. Price is on this board, we have 20 people in the room. Sometimes we really don't know, what could have been done or to have changed the outcomes. But, we're continuing to move forward again, from the Infant Mortality Reduction Coalition to, I think with our Health and Human Services model with behavioral health, and the gun locks, opioids, making sure that drugs, because we've seen that ingestion of drugs. So, making sure that people have lock boxes and just have that wrap around. Again, not just our babies are safe, but our children are safe. Working with the school system, they're a key partner because their kids spend almost as many waking hours in school as they do anywhere else. So, with that being said, I just want to say, I appreciate the support of the commissioners. Again, we'll get this, I don't know if we can do it electronically or just a paper copy to make sure that you have the corrected presentation. But I'd be happy to take any questions.
Any questions for Josh?
Thank you.
Thank you very much. All righty. We will recess until we have